Hello there. How you doing? I see. Well, I hope by the time we're done with this annual physical exam, you feel even just the littlest bit better. Would you mind if I just confirm your name and date of birth? Good. And is that your preferred name? How do you like to be addressed? Wonderful. So, looking at my notes here, I already have pretty comprehensive health history, medications, allergies. So we will do a little bit of discussion with that at the end. Just want to make sure that these are updated. And we did already get your vitals. That's good. So BP was a little high, as was the pulse. So I think what we're going to do for that one is after we do our examination, we'll go back and measure that. Some people measure a little high when they first step in the office. Sort of a knee-jerk reaction, I think. So with that, I think we're going to start with your ears. So we're going to hit our major points for your physical exam. Your ears, eyes, nose, mouth, skin, heart and lungs, abdomen, extremities. Is that all right with you? Wonderful. Do you mind if I touch you for the purposes of this examination? Excellent. So, let's take a peek at your ears. So, any particular issues that you've noticed with your ears as of late? Good. And we're getting into the end of allergy season, but the start of sinus season. Have you had any issues with that? Alright, good. That's good. That's one of the worst parts about the weather changing is the allergies and then the sinuses. So, I am going to grab my otoscope. And let's see, just want to make sure. Okay. Little flickery, but holding strong. And then we're going to grab a speculum. There we go. Wants to be tricky. Rather tricky things. And then let's just go ahead. The battery likes to act up in these compartments, a little goofy, I think. There we go. So, do you have any preference as to which ear I start with? Alright, I'll start over here. And let me know if you have any pain or tenderness, alright? Okay, let's go ahead and just pull the ear back. Then we're just going to right there. There we go. Let's see. We've got the ear canal. That looks pretty clear, no obstruction. pretty good. And then we'll look at the other side. Up back here. And just, there we go. Just hold still as best as you can. I'm not going to poke you if you do. Got my little finger braced against your head, so won't go in any farther, but be a little bit awkward. Just have to reset us all. Here we go. Everything looks pretty clear. Just pull it out. There we go. So I won't need that speculum any longer. Let's go ahead and take a little peek here. Yours look pretty clean. Tissue's not irritated at all. The tympanic membranes are intact. They look great. There we go. We're going to do a little bit of a hearing test. You haven't noticed any issues with your hearing, right? No. So this is going to be a little different. We're not going to be using tuning forks or the finger rubbing or the whispered hearing test. Instead, we're just going to be doing these little taps that will gradually get softer. You just let me know when you can't really hear it anymore, right? Mm-hmm. Good, okay. Right. Good. So we're going to be bringing that back for a few different parts in this examination. So it's kind of an indirect percussion is what it's called. So then, that was pretty good. And then let's take a peek at your eyes. I'm going to get a little more up close here. And we're going to look around at the eyes. So, any problems with the eyes lately? Any itchiness, wateriness? With all the dust that gets kicked up. A lot of times, even without having many allergy issues, you still get a sort of gritty feeling. Do you happen to use eye drops regularly? Mm-hmm. The eyelids and the sclera. Everything looks nice and pink here, not irritated. one of the lucky ones there. Your eyebrows are intact, eyelashes, good distribution. Good. And if I press around the orbit, any pain here? No. Okay. Let's grab a light. And we'll give this one a second as well. And we're just going to check your pupillary response here. We want the pupils to be equal, round, and reactive to the light. If you could just look right here. I'm just going to check the response of the pupils here. Good. Just keep looking at my nose. Good. There we are. Fastest muscles in the body the eyes have. Very important. Otherwise, you have kind of a goofy accommodation reflex, for example. Nothing really looks in focus, which is frustrating. There. Even with just this little bit of light, looks like still pretty reactive. I just get that little bit right there. Good. Okay. So now we're going to do a bit of a switch here, and I'm going to have you follow this instead with your eyes without moving the head. I want to test the eye movement as well as the accommodation reflex, that little tool your eyes have to be able to focus on things up close or far away. Just keep following this as best as you can. It's going to be a bit random. Might go out of your field of vision a bit. Just do the best that you can here. Good. I want to make sure your eyes can move in every direction comfortably. There isn't any delay, skipping, lagging. Good. A little quick. You seem to be doing just fine there. Excellent. Let's come up here. Down here, good. Right back here, and right up here. There we go. Good. Okay. When was the last time that you had an eye examination, the full shebang? Alright, and do you wear glasses or contacts at all? Pretty sure it said here, but I can't quite agree. Very good. Moving on here, we're going to take a peek at your skin as well as your hair. So, gonna take a good look. We'll start here, right here at the forehead, and just taking a little feel. Good. And we have the cheeks right in here, as well as the temples. Let me know if any of this is painful or tender. Good. And have you had any problems with your skin that you wanted to address, or that you had any concern about at all? Alright, good to know. So I'm feeling the texture of the skin. Do you find your skin is generally drier, oilier, or a combination? Or it might not be either. Normal skin's kind of, I won't say rare, but they're certainly a blessed part of our population, huh? Yep. Alright, along the nose here, right in here. Right between the eyebrows. Okay. Alright, good to know. Skin type there. If that changes, keep an eye on it. You can let us know as well. Good. And then we have right down in here. Right in this area. Right here. Excellent. So let's come right up in here. Look at the hairline. Right around the ears. Back here. Good. And the hair itself. You noticed any difference in the texture, in oil production, even maybe hair pattern? Sometimes the hair changes pattern. Maybe due to a lot of different things. Sometimes it's as simple as getting your hair cut changes the pattern. Okay. Oh, your hair feels pretty strong here, consistent with your hair type. I'm not getting any little stray hairs, so probably not any issue with hair loss. Good, good. Okay, so integumentary system so far looks pretty good. We will be looking at that in some other areas as well. But in terms of the face and the neck here, looks pretty good. The sinuses and the lymph nodes. I am going to be pressing in along the major sinus cavities here. We have frontal right in here. Is this painful or tender at all? And ethmoid right in here. Good. And maxillary right here. Anything in here? Good. And I'm going to do some tapping along here. Let me know if this is painful or tender. Right in here. Okay, getting down into the point. Right in here. Okay, and maxillary right in here. Good, just running the circuit a bit. And nothing. Okay, direct percussion, all good then. And we're going to get the lymph nodes here. Oh, occipital, post-auricular, pre-auricular, and submental, submandibular, right under the jaw here. And then anterior cervical, posterior cervical, deep cervical chain, and then finally supraclavicular. Okay, no distension with any of those, and you haven't noticed that any of the nodes have been distended at all? Okay. Yeah, usually you'd notice something like that. It's a very odd sensation. There we go. Okay. Going back to the nose. So let's grab the otoscope. And we can take a peek inside the nose. So if I could have you tip your head back here. I'm gonna take a little peek. Any issues with your sense of smell? Any issues with breathing? Okay, and do you snore? Right, good to know. Septum looks good. The nasal passages look good. Okay, now we're going to do a little breathing test. So I am going to occlude one side of your nose and make you get a little nasal there. And I'm just going to have you take a couple breaths through that other side. Make sure that it is working just fine. So have you take a deep breath in and out. Deep breath in and out. Good. And the other side here. Deep breath in and out. Deep breath in and out. Good. Did that feel like it had any difficulty whatsoever? Okay, very good, not so much. Alrighty, so let's grab my light here, and I'm gonna grab a little tongue depressor. There we go. And I'm gonna take a peek inside your mouth, so if I could just have you open your mouth and we'll look around at the oral cavity to start. won't ask any just yet. Okay, can you open your mouth just a little bit wider? I want to check the teeth. Okay. Good, and can you lift your tongue up? The roof of your mouth there. There we go. Good, okay, and you can put your tongue down. Alright, let's grab. So I'm just gonna have you stick out your tongue, and then just gonna put the tongue depressor on there. There we go. Alright. Throat looks good. Throat wall is normal color, normal texture. Okay, can you say ah for me? Okay, there we go. Go ahead and close your mouth. Alright, so now, question time. Any changes with your sense of taste? Alright, do you feel any sort of odd texture or any new bumps, any sores or anything in the mouth? Okay, and how has your throat been? Any soreness? You had any hoarseness at all? Okay, so we are going to move on to the heart and lungs. First, we're going to do a little bit of palpation here. I'm just going to feel primarily around the heart area. On the left side of the chest here. You can feel for any palpable heart murmurs here. These are called heaves and thrills. And each one uses a different part of the hand to feel for them. The heel of the hand or the flats of the fingers. Good. Have you noticed any sort of lightheadedness, breathlessness, palpitations, racing heart, slow heart? Okay. Good. Okay, let's get some percussion in. So we're bringing back the taps, and I'm just going to be doing this on both sides of the chest. We're going to work in sort of a ladder-like motion because we're always comparing one side to the other. I'm going to start and just keep breathing normally. Good. And we're listening the sound that comes back, and naturally the sound should get lower the lower we go. There we go, good. And some auscultation. Fancy name for listening to the heart and lungs. So we're going to start with the heart. I'll just have you breathe normally. We are going to hit our 4 valve areas. So aortic at the top. Pulmonary is lateral to that. Go a little lower for mitral, or tricuspid rather. Jump the gun there. Mitral's our next one. Mitral. Okay. Just listen to those valves open and close. Good. Now for the lungs, I'm going to have you take some deep breaths. When I put the stethoscope on your chest here, deep breath in and out. Deep breath in and out. Deep breath in. Deep breath in. Deep breath in and out. Last one. Deep. Okay, we're going to move to the abdomen. Just breathe normally here. We do sort of a reverse order here, because if I were to start poking around in your abdomen, it's going to make much different sounds after that than what it originally would have. So let's start with the auscultation, and then we will do some percussion. And then we'll do palpation. All comes full circle. This would be the ideal time to check your heart rate and your blood pressure right after we do all that deep breathing. Oh, some percussion here. We can map the borders of the organs using percussion, using sound. Takes a lot of practice though. Distinguish the borders of the liver, stomach, where the intestines are all curled in. Good. It's one of my favorite things about percussion is the ability to see, to visualize without actually seeing what's going on in there. Using sound, building a picture with sound. Good. Okay. Now for the palpation here, I am just going to be pressing in. Let me know if this is painful or tender. And then we'll do some deep breathing when I have to get both hands in there, because that's not very comfortable. It's not super comfortable for me either, to be honest. Be putting so much force into someone's abdominal cavity. Don't like that. But it is necessary. Alright, so both hands here. And the trick is to keep breathing through it, because I'm going to be pressing against you trying to breathe, alright? So we're going to take a deep breath in here. And on your out breath, that's when I can do a little feeling around. Deep breath in. Out. It doesn't feel like I'm punching the air out of the air. Deep breath in. And out. There we go. And that's it. That's all there is to it. So, heart, lungs, abdomen. Cool. Very cool. We are going to move on to testing your reflexes. Little neurological test before we look at your extremities. Today we have the Queen's Square or queen square rather, reflex hammer named after the place it was developed at. So this little bouncy guy, I'm just going to start with your feet here, your ankle jerk reflex. If you could put your foot right here on my knee, that way I can hold you here in a way that I can get the Achilles tendon just right. So we're going to just do a couple bounces here and then there we go. That's what I like about this one, is it's very bouncy. Very bouncy. So, other foot up here. Good. And I'm going to hold your foot while I do the reflex here. Get a couple bounces and then there. So, the thing about it being so bouncy though is it can feel a little imprecise. I like to do just a couple test bounces before we get in with the good arc. So, next we're going to do the patellar reflex here. And I'll have you just let the legs go completely loose. Just let them hang down. They'll feel very heavy, feel quite limp, right? And we're just going to do a couple test bounces here. Okay, and then we'll go. Good. Other side. Test bounces. Then. There we go. Just like that. Now I'm going to get the triceps and biceps reflexes here. I'm going to have you put your arm over your thigh. So if you want to put just the span of your forearm along the thigh. Let the hand hang loose off your leg. And then I'll get the back of the arm. And then I'll hold the arm. So triceps here. Get some test bounces. Good. And then there we go. Get some good ones in there. I'm going to hold your arm, put my thumb in the crook of your elbow. I'm going to tap on my thumb. Oh, that's why we do test bounces. There we go, and then. Very good. Other side, you want to just let your arm rest down, cross your thigh. Very good. Excellent. Get some test bounces in there. Good. Then we will just grab the elbow here, put my thumb in the crook of the elbow, test bounce. There we go. Just like that. We did. Coming back to the integumentary examination, and we'll test your extremities a little. So, I'm going to look at your arms here. And we'll look at the hands and nails. Any issues with the skin on your extremities, the joints, nails? Good, and the other side, then we'll look at the hands. Good. Looks good, and temperature feels good. Joints don't have any heat to them. could just splay out your hands for me. Just want to take a peek at the nails and the capillary refill here. Okay, so nails look good. No ridging, no nodes here. Color's good. Okay, looks pretty strong, not too brittle. And I'm just going to feel around the joints as well. You let me know if it's painful or tender, and then we'll come back to capillary refill. Anything here? No. Okay, other side real quick. There we go. And I'm just going to press, release on each finger. Good. There we go. Okay. That looks very good. So, I'm going to have you do a few strength tests for me. I'm going to have you just make a fist real tight. Okay, open your hands real wide. And I'm going to put a finger out. If you could squeeze it as hard as possible with just 2 fingers. Good. And can you squeeze my hands as hard as possible? I mean, don't try to break my hands, but you know. Okay, good strength there. I could have you put your arms up like this. Okay, I'm going to try to push you. I want you to resist me. Good. I'm going to try to pull you towards me. I want you to resist me. Good. And now I'm going to have you shrug your shoulders. Good. I'm going to try to press them down. You press up against me. Good. I'm going to have you bring them up. I'm going to try to press down. You resist me. Good. Okay. Now the legs. Again, nothing with the skin or the joints. Okay. Do you have any problems with swelling in the feet or the ankles? Okay, just more after a long day. Alright. That makes sense. Joints feel good, and doesn't seem to be any swelling in the ankles here. Good. Let's see, we've got post-hip pulse here, and then dorsalis pedis. Okay, I am going to try to press your feet down. I want you to press up against me. Good. And I'm going to try to press them up. I want you to press down against me. Good. I am going to try to press your shins forward. I want you to press out against me. Good. And I'm going to come to the back of your calves and try to bring them forward. I want you to resist me. Okay, very good. Now let me just grab the pulses in your arms here. We've got radial. We'll come back to this one in a second. Good, and ulnar. Go. Yep, and brachial. Alright, so let's go ahead and grab your heart rate and your blood pressure just to see if that was any better from earlier. So I'm just going to have you breathe normally here. Just add it. There we go. Your pulse was kind of in a goopy place. I'm just counting the beats. About 15 seconds and we'll multiply by 4. beats per minute. There we go. I did drop a bit there. There we are. Okay. So we've got 72 beats per minute. And then blood pressure. Just grab my stethoscope. Pop that in just so I have the room to work around. So we've got our dial and our bulb here. Yeah, I'm just going to use this arm if that's okay. Okay, good. And I've got a little clip here on my dial, so I'm just going to put that right there so that I can have a hand free to put the stethoscope in the crook of the elbow. Let me just make sure my valve is not closed. There we go. Close the valve. And then this is going to get quite tight, okay? It doesn't last very long though. Let that go. Get the diastolic right there. Good. Let that go. We'll do it just one more time. Close up the valve. There we are. Good. Okay. Let that empty out there. Just going to take my stethoscope back and the dial. Okay. Let's go right there. And this can go right next to it. So, nice, healthy 120 over 80 millimeters of mercury. Now, we are going to just review your history here. Now, I know you answered these questions, pretty much do it at most appointments, I would think. But I want to make sure that I'm also doing these. If you had any particular past health issues, acute or chronic. Okay. Any past injury or surgery. Okay. And are you taking any prescriptions? Okay. And that's as needed. Good. And any over-the-counter medicine at all? Any vitamins or supplements? Do you have any allergies to any medications? How about food? And any environmental allergies? Anything else that you could think of? Are you working or a student? Okay. And what would you do / study? Okay. And any alcohol use? Tobacco? Okay, and that does include vapes as well. Okay. And any recreational drugs? Lame. Let me flip this over. Okay. And how would you describe your diet? What does that look like for you? Okay. Any food sensitivities or intolerances? Right. And what does exercise look like for you? This is doing activities outside of what you normally would do, like walking around at work or on a campus or what have you, running around, things like that, running errands. Okay, all right. How often do you do that? Good. Okay, anything else? Any other kind? Okay. And how would you rate your stress levels? How stressed do you think you are? Yeah. Aren't we all? Right. And do you use any particular mental health management sort of techniques, I suppose one could say, like meditation or grounding exercises, hobbies, physical exercise? Okay, and do you receive or have you received any mental health services? Okay, and let's see, so we are up to date on vaccinations, all good. So we'll be doing that TDAP here soon. And then, what was your height and weight approximately? Gotcha. Yes. I'm 5'7" myself. Taller than quite a few of the people around me, but several of my brothers are well over 6 foot, while another brother is like 5'6". But everyone else taller than most. So that is going to end it for our examination today. Do you have any questions at all? Alright, so let me go ahead and just sign off here. Got everything all corroborated. There we go. I'd like to thank you so much for coming into my office to receive your annual physical examination. It is a very important part of preventative care, so I'm really happy that you made this appointment. I hope you have a whale of a day and a good rest of your night. Thank you.
Thank you so much for watching. I really appreciate it. If you enjoyed this video, it would greatly help me out if you clicked the like button and left a comment so YouTube's algorithm registers that it was a good video. If you want to see more of my work, consider subscribing to the channel. I create primarily medical, pseudoscience / alternative medicine, and personal attention ASMR roleplays. But I've done a little bit of everything from historical to sci-fi to fantasy. If you'd like to support the channel, I offer ad-free videos, early access on videos, and exclusive content on Patreon, or I also